So, Dr. Alon.
Thank you very much. Thank you very much, Saul, for this kind introduction. Thank you, Armin. Thank you, Dov. I think this presentation can be done also without microphone. That I wait the microphone for the lecture. Thank you very much. Thank you very much, Saul, for the kind introduction. I repeat it. Thank you, Dov. Thank you, Armin, for the kind invitation to come here. It's a great honor for me to be here to lecture, but also to follow the lecture of the ambassador. It's not the first time that I'm following his lecture as past president of Magen David Adom Friends in Switzerland. I had often the opportunity to talk after or before him, and it's always a good thing and a great honor. And you said about your problem you had by skiing. You should have maybe tried cannabis. It's maybe it's not a good idea because one of the publications are known that cannabis doesn't work in acute pain. So it's very important to distinguish between acute pain and chronic pain. But anyway, it's not exactly the topic of our problem now, of our lecture. And I will begin with some good news about cannabis. The cannabinoids interact with receptors in the brain. This is one of the basic research that has been done and is for sure. They inhibit pain signals which are sent from the body to the brain, and therefore this action reduce the pain intensity in these patients. So this is very important news for the treatment of chronic pain with the cannabinoids. I had a little bit of problem preparing this lecture because I had a 100 slides lecture in German, which I had to reduce to 15 slides in English. And I tried to do my best. And also during the lunch session, I skipped some slides because I saw that it was I was repeating some notice that was done by my colleagues during the last slides. So some of the clinical indications of cannabis and cannabinoids in medicine is, as was said sometimes before, is the treatment of nausea and vomiting, the treatment of loss of appetite and weight loss, spasticity, for instance, multiple sclerosis, and pain. There are more than many publications concerning chronic pain, tumor pain, polyarthritis. Then they have also they work also in neuropathies, in lateral sclerosis, restless legs, Parkinson. Concerning the anti-cancer agent, is a problem. We have a lot of publications, but they are not really good results that can demonstrate that we can use cannabis and cannabinoid as anti-cancer medication. We heard about the side effects. If we use a drug, we have also the side effects of this drug. But it's known that the side effects of cannabis in the doses that are legally used in Switzerland are rare and dose dependent. So in the dose that we use, they are very rare. It might be dry mouth, reddened eyes, sleepiness, increased heart rate, reduced blood pressure or dizziness. So minor side effects. And the most important side effect that is very feared is the dependence. And cannabis has a very low dependence potential. In therapeutic use, medical products containing THC do not cause problems of dependence. And I know there is a discussion what kind of medication you give your patients. So in Switzerland, we have only 3 possibilities of medications. We don't have the possibility to smoke, legally. To smoke cannabis is not allowed as a medical cannabis. And we have jonabinol, which is a synthetic product of THC. THC is synthetically produced. We have the cannabis tincture, which is and THC, and we have Sativex, which we use for multiple sclerosis. Now we have in the last month of 2018, beginning now with 2019, we will have also CBS as a pure substance that we can produce and prescribe in Switzerland. How we prescribe it, we know it's not easy, but it's possible. And comparing to other countries, it's relatively fast. We have always success stories in internet and that let people hope. Internet forums, Facebook groups, and a lot of anecdotal, and we have to distinguish between this information and the information we can have from scientific publication. And when we look in PubMed and we want to get out how much was published in the last year, you see here, you have from 1970 to 2020, there was increase in publication from 1995, always more and more, and this is the numbers. So we have now about 6,000 publications of cannabis and cannabinoids. The problem that these publications are not always randomized, as we said before, randomized control studies, that we take the drug and we compare it to placebo or to other drug that may have the same efficacy. And we can take the experience of Israel, and I'm happy to see here so many people from Israel, and I have very good friends there that are working with cannabis and with pain treatment, and I was told that they were treating at the moment about 34,000 patients with cannabis and cannabinoids. They have daily 200 to 500 new requests for treatment. They have over 200 research proposals approved and about 50 clinical studies in process. So a country which is, I'm an Israeli and I live in Switzerland already many years, but I'm proud to be an Israeli, proud to be Swiss and citizen. And when I compare these countries that have about the same number of inhabitants, it's incredible how much work is done in the area of cannabis compared with what we are doing here. So I spoke with people and they present me a paper that was recently published in Israel. This is not a scientific paper, but this is a kind of questionnaire that was sent to about 60 or 70 opinion leaders in pain medicine in Israel. And each of them wrote in this questionnaire what is his experience with cannabis. And this unbelievable, what was the positive answers of this specialist. And they said that their experience is so good with him that it's a good drug, it's safe, relatively safe, and works good. And they suggest to change the paradigm among cannabis in this area. It means that at the moment you use cannabis only as last choice to treat chronic pain, but you should try it before, because it's an alternative to other drugs. When we compare it with publication in Switzerland, you can see in this publication for 2 years, they looked how many requests for cannabis were done in Switzerland, and you can see, and I have a big part of this, and chronic pain only about 500, and spasticity about 350, and neuropathic pain less, nausea and tremor much less. So the number of patients treated in Switzerland may be 1% of the number of patients treated in Israel. So the clinical experience of the doctors, it's much more there than in our country. This is a difficult slide to look at, but I'll try to summarize it. This is an American review about papers treating pain, nausea, and spasticity with cannabinoids. And the results, the results are not bad. 30 to 40% of the patient had good results. But the problem is that you compare it with placebo, they have also 23 to 30% of placebo. So this is very often the problem. If you don't have placebo, you think, yes, it works, not bad. If you have placebo, you see that the difference is not so big, so you don't know if it's really so good or not. And then another problem in the research is these numbers here, excuse me, numbers needed to treat. How many patients you have? Ooh la la. I'll try to skip other slides if I have only 4 minutes. Number needed to treat is how many patients you have to treat to get a good result. So ideally it was one patient, good result. 2 patients, half of the result. The low number of NNT are good, the high numbers are not good. It means that efficacy is not so good. And you have not so good numbers needed to treat for cannabis in pain. Then you have another work from Australia about the side effects, and you see that, as I said before, the side effects tachycardia, agitation, but not really very dangerous. The most important work that was done, published last year in Pain, which is the most important paper in pain research and clinical, is this systematic review of meta-analysis. They took 104 studies in 91 publications, and they took randomized control studies and observational studies, and they about 10,000 patients with this many. And you see the results are not so promising. They have cannabinoids are unlikely to be highly effective medicine to treat non-cancer pain. Moderate to high-grade evidence that THC and CBD achieve modest pain reduction in multiple sclerosis. Number needed to treat is high, and long-term efficacy is unknown. So I can try to summarize all these papers in few words. And this is my personal conclusions of the scientific work done in cannabis and cannabinoids. So first of all, cannabis and cannabinoids are relatively safe. They have a modest pain relief and present a reasonable treatment options for chronic pain. So they are not strong opioids like opioids, but they are safe. They have less side effects, and they have to be an alternative and not last choice for the use of chronic pain. They seem also to be an alternative for other diseases, not only other symptoms, not only pain, nausea, loss of appetite, spasticity, and depression. Other conclusion, important conclusion from the literature that not all, it will be also very discussed, there is not sufficient scientific evidence that smoking cannabis herbs is more affecting the THC alone or THC and CBD together on CBD. So drugs should be given as medicine and not as smoking medicine. And personally, I recommend to use cannabis as a standard prescribed drug, as was discussed here in the beginning, and we hope that we can have it in our future in Switzerland and in Israel as well. Thank you for your attention.